office. And this is based on questions that we receive, applications that we receive, or things that we get in and we start looking at it and we say, well, this really didn't need to be reviewed anyhow. So this is what we're going to talk about today. So if you have any questions or concerns during the course of the presentation, please feel free to shout them out. This is, we're a pretty relaxed forum here. We give you sugar, so you guys should be wide awake, and coffee. So for those of you that don't know me, my name is Courtney Romaine. I'm the Education Outreach Coordinator at the Office of Human Research. With us today, we have our IRB analysts, Brittany Lewis and Elizabeth Cookson, and also our director, Carly Emerson. So, and as always, Glenn. Everybody knows Glenn. All right. So what we're going to talk about today is quality assurance and quality improvement projects. We've been seeing quite a few of these lately. So sort of the bulk of our information is going to focus on QA/QI projects. This also applies to program evaluations. We're going to be talking about consent and when a waiver of consent or a waiver of documentation of consent is appropriate. Retrospective and prospective research. What are the differences and when does one turn into the other? Modifications, what you need to submit for a modification. Will the Office of Human Research help you with your application? Information about the principal investigator and if you have a grant. And then other frequently asked questions that we get through our office sort of on a daily basis or things that are focused on during the preliminary review process that the analysts see commonly in synopsis forms or exempt applications. So welcome new people. Grab a cookie, grab some coffee, have a seat. So what is quality assurance and quality improvement? It generally refers to a range of activities conducted to assess, analyze, critique, and improve current processes of healthcare delivery in an institutional setting. So a lot of these would be maybe you're doing a QA/QI project in your own clinic and you want to see how quickly it takes for patients to get appointments and then how many prescriptions are given for a particular type of vaccine. So these are the things that might be considered QA/QI projects. They're often observational and unobtrusive, and they can involve collection and analysis of data to which investigators have legitimate access through their institutional roles. So if you are a provider in this clinic, or maybe you're the clinic manager or coordinator, this would be within your purview to access this data. These activities do not prevent or hinder the delivery of clinically indicated care to patients, nor do they impose more than minimal additional risks or burdens on patients or providers. So if you're just asking patients to do a survey about their care, how quickly they got through the triage process, things like that, it might fall into a QA and QI project. So if you're going to keep this within your clinical setting, or maybe you're doing something for educational purposes and you're doing it within an educational setting, it might fall into a QA/QI project. So generally speaking, QA/QI projects are intended to assess and improve internal practices, programs, systems, and are not designed to contribute to generalizable knowledge. So our benchmark still is, are you going to publish or present your findings? But don't think that if you're doing a QA/QI project and you want to publish or present your findings, that means it's automatically human subjects research, okay? So again, this is in general terms, but there are instances where a QA/QI project may not be human subjects research and you can still contribute to generalizable knowledge, okay? So we want to ask, does a quality improvement project that involves research need to be reviewed by the IRB? So, of course, our famous answer to everything is it depends. So in some cases, yes. IRB review is required if the project meets the definition of human subjects research. So if you are obtaining identifiable private information about the individual and you are also doing some sort of interaction or intervention with them. However, if your project involves research in the QA/QI component, use a standard IRB application form. So we have a standard form for that. If you're uncertain of whether or not your QA/QI project meets the definition of human subjects research, please feel free to reach out to our office. We are currently in the process, as many of you know, revising many of our policies. So I feel that this is something that's going to be coming sort of down the pipeline about QA/QI projects. I also have a handy dandy little checklist, and I know this is very difficult for you to see right now, but this is something that we are going to adopt and actually put on our website for you to use to determine whether or not your QA/QI project does need to be reviewed by the IRB. So for those of you that are unable to see this, I'll go ahead and read them out to you. So it's sort of a yes/no checklist. So the first question they ask is, the primary intent of the project is not peer review publication, and if the publication of the results was prohibited, the project would still have merit under the QA/QI effort. So if you were not allowed to publish or present your findings, would the project that you're doing still continue? The purpose is to improve the quality of the program under investigation by assessing and encouraging standard medical care or educational goals. So what is your initial intent with the project? The PI has both clinical supervisory responsibility and the authority to impose a corrective plan based on the outcome of the project. So maybe you are a medical resident, but your department chair wants to sign off on this, or the clinical director wants to sign off on this, then you would check yes in this instance. The project does not involve prospective assignment of patients to different procedures or therapies based on a predetermined plan, such as randomization. This one is clearly a research activity, so if you are doing that, you are not doing a QA/QI project. The project does not involve a control group in whom therapeutic or study intervention is intentionally withheld to allow an assessment of its efficacy. So again, if you're doing this, it is not considered a QA/QI project, but rather a research project. The project does not involve the prospective evaluation of a drug, procedure, or device that is not currently approved by the FDA for general use, including off-label indications. Okay? So if you are using drugs, devices, things of that nature, and you're going to be doing work with those, then that is a QA/QI project. Now that does not include just looking at records to see if, you know, a drug for Zoloft has been prescribed, or excuse me, a prescription for Zoloft has been prescribed. So if you're just looking at that, that's fine. But if you're looking at, you know, maybe blood levels of somebody that's been on Zoloft for a while, that's probably not going to be considered a QA/QI project. Participants won't be exposed to additional physical, psychological, social, or economic risks or burdens beyond a satisfaction survey or something very less than minimal risk in order to make the results of the project generalizable. And finally, adequate protections are in place to maintain confidentiality of the data to be collected, and there's a plan for who can access any data containing participant identifiers. So again, this is something that we are working on. I actually borrowed this quite liberally from Rutgers University. I think that they have a wonderful QA/QI checklist here. So we are actually going to adopt it for our own purposes and put it on the website. That way you can go in and sort of do the checklist and make your own determination. Again, with our determination worksheet, if you're still uncertain, you can always contact our office about your project and whether or not it meets the definition of human subjects research. And the reason we really wanted to get into this is we've seen a lot of QA/QI projects come in, or program evaluations come through the office that have been submitted as exempt research, but we actually determine them to be not human subjects research, and we provide that written determination. So before we move on, does anybody have any questions about QA/QI projects or program evaluations? Yes.
So, two questions. So if you meet all this, you do not have to submit?
That's correct.
Okay. And what happens if you do a fantastic QA project? It's clearly QA, but then after you do it, it's so great that you want to publish.
You can publish it as a QA/QI project.
It kind of be like a case study where you're just saying your experience is what you've done. You're not trying to say, you know, you should implement this at your institution, or that you're not kind of generalizing the results beyond your specific program, and so that would be fine.
But you don't have to go back to get some kind of, okay.
No. Generally when somebody, and we've had people do that they did a QA/QI project and then they want to come back, a lot of times they'll say, well, do you have a research question? And they say, no, I don't have a research question. I said, well, you don't have a research question, then it's not research. So that usually kind of clicks the light bulb. So yeah, so if that happens, you're free to go. And if you're uncertain or you need documentation of an IRB review for submission to a conference or a journal or something, feel free to submit your project with a determination worksheet to our office, and we can provide you with that written determination. That way you have it in your pocket and you're ready to go. Okay. Any other questions about this before we kind of continue on to other views of our daily life in the office? Right. Yes, Brittany.
So in the event that PIs have a QA/QI study that they want to publish, and they want that written letter from us to go ahead with that, do they need to specifically state that it will be presented as a case study, and they're specifically talking about their institution, and they're not trying to generalize the
Yes.
language beyond?
Yes, they should detail in the determination worksheet that this was intended as a QA/QI project or a program evaluation, and that they just want to present their findings because the findings were very interesting. And it wasn't necessarily something that they intended for other places to adopt or replicate. Yes? Hi.
In terms of a question, is it better to call the office or email the office?
Email the office.
And that's at the
OHR IRB.
IRB.
Yeah, it's always better to email because generally what will happen is if you call, there's a lot that can be lost in translation in a phone call, and we actually like to have everything documented. We're regulatory people, that's just how we roll. So we like to have everything on paper. So submit the determination worksheet or an email detailing what you're doing, and it will go to the appropriate person in the office to provide you with that determination. And we may ask for additional, information, like maybe we want a copy of the survey that you handed out, or, variables that you were looking at from records. So we may ask for that. Okay. Hi, good to see you. All right. So informed consent. This is something else that has been coming to our office a lot lately, and whether or not you can get a waiver of consent. We have had instances where people have said, well, it's very difficult for me to obtain consent even though they're going to interview the person or survey the person directly. So I think there's a lot of confusion about what a consent waiver means and actually what consent means. So when can you get a consent waiver? If your study is minimal risk and meets the criteria for either a waiver of documentation of consent, wherein you would still obtain verbal consent, so you're telling the person about your study, you're letting them know what you're doing, and you're asking them, do you wish to participate or do you want to continue? And they say yes, you're still obtaining consent. It is just a verbal consent. A waiver of consent is no consent process. This is typically utilized in cases where you have no contact with participants. So these are your large-scale retrospective document reviews or chart reviews. Maybe it's a retrospective and prospective chart review where you're unable to, get in touch with 20,000 individuals, and you just want to look at records and start obtaining that data. A study is not granted a waiver for convenience. So the example that I gave you where the investigator just said that there was no way they could get consent, but they were actually talking to the person, that's not a legitimate reason. We don't give you a waiver of consent for convenience purposes. And you must provide justification for either one of these waivers to the IRB. We're going to know why, we want to know why you're asking for that waiver.
Courtney,
Yes.
For research studies involving online interventions, surveys and questionnaires where the participants are just checking the box that say, I consent to participate, can we consider that standard consent or waiver of documentation?
If you're just doing a check mark and you're not physically signing something, I would consider that a waiver of documentation of consent. Yeah. Because generally speaking, when you think of documentation, you think of a standard signature. So these are the federal regulations that allow you to obtain either waiver, and this is what the IRB looks at when we are looking at your projects, we're looking at your applications, and if you ask for a waiver of documentation or a waiver of consent, we're going to look at your study and see if it meets this criteria. So a waiver of documentation, an IRB may waive the requirement for the investigator to obtain a signed consent form for some or all of the subjects if it finds either the only record linking the subject in the research would be the consent document, and the principal risk would be the potential harm resulting from breach of confidentiality, or the research presents no more than minimal risk of harm to the subjects and involves no procedures for which written consent is normally required outside the research context. So many times, we may even tell you, you meet the criteria for a waiver of documentation of consent, and it actually reduces the risk to your subjects. So sometimes we even recommend that and suggest it to investigators and research team members.
So just to comment on the waiver of documentation on that first blue bullet point there, that would be an example, would be if you were doing an HIV study of interviews or data collection from maybe HIV participants, and you weren't collecting any other identifiers for them, their birthday, their address, their telephone number, their email address, none of that. Otherwise, it was going to be anonymous except for the consent form. Then we would suggest in those cases that you'd get a waiver of documentation of consent, because the primary risk to that participant would be having their name on a document that says you're being recruited for this study because you have HIV. And if their name wasn't recorded anywhere, that there'd be very low risk or no risk at all to that. So that would be the case that we might actually suggest to you, do you want a waiver of documentation for consent? You would still obtain verbal consent from them, but you just wouldn't have them sign some document that would increase the risk to them.
And you should still provide them with a copy of the consent document for their records.
And it should still contain all the essential elements. It would basically look just like a written consent, except it wouldn't have a signature line.
So for a waiver of consent, an IRB may approve a waiver of consent or altering an element of consent, providing that we find all of the following. So for the first one, it was an either or. For this one, it's an all. So the research involves no more than minimal risk. So for the full board studies, you cannot get a waiver of consent. The waiver or alteration will not adversely affect the rights and welfare of the subjects. The research could not practically be carried out without the waiver or alteration. And whenever appropriate, subjects will be provided with an additional pertinent information after participation. So if you are doing a large-scale retrospective document review or chart review, and as you're going through it, you find something really intriguing about all these people that they may need to know, you might want to send that information out to participants that you have been reviewing their documents. Okay? And just let them know that you were doing this, the IRB reviewed it, they weren't consented for, these reasons, but here's this information that we found. It might be interesting to you, okay? Or it might be important to you. So those are the regulatory definitions. So Carly gave an example of a waiver of documentation. So again, a consent form would be the only place the participant's name is linked to the study, and maybe the study is otherwise anonymous. An association with the study via signature or possession of a consent form poses risk. There's still an informed consent conversation with a script. So when I say that you have to, offer a copy of a consent document to a subject, it is within their right to refuse that, so long as you are doing your due diligence to provide it to them and offer it to them. A lot of individuals, especially if you're working with a population that's engaging in some sort of illegal behavior, they may not even want that on their person. And that's absolutely their right to refuse that, so long as you have offered it to them and you have given them that opportunity.
And ideally, you would make a note to file if you offered it to someone and they didn't want it for your research study.
Right. A minimal risk study may involve a phone survey. Subjects give oral consent over the phone but are not available to sign a form. A telephone call may be followed up with mailing of the information or emailing of an information. And finally, another example is an expedited review internet survey that retains the identity of respondents, provided all requirements of informed consent are there, but documentation is waived. So this is just a few of the examples where a waiver of documentation may come into play. A waiver of consent, however, would be non-sensitive data obtained from 5,000 existing medical records. All data being reviewed is in existence at the time of IRB submission, so this is your retrospective chart review, your truly retrospective chart review. Investigators need to document and maintain identifiers in order to compare medical records from different sources. So if you are going to collect information such as name, medical record number, date of birth, anything like that that considers a direct or indirect identifier, then you could do a waiver of consent here. There will be no participant contact, and it's not feasible to contact all participants for consent. So especially if you're doing research here, you all know that DC is a very transient area, and so we get a lot of people that come into the clinic and maybe they're in there for a couple of years and then they're transferred somewhere else, or they were maybe they were diplomats from another country and then they're gone to somewhere else, or they go back home. So this is a very common occurrence, and this can be done for either an exempt or an expedited retrospective chart review. So, retrospective versus prospective, which is which? So what does retrospective mean, and when can a retrospective be exempt, and when is it considered a non-exempt? So retrospective versus prospective. So retrospective research may be exempt or expedited. Okay, so it can be either one of those. It doesn't really matter. Generally, you get a waiver of consent for a retrospective document review or chart review. You may request a full or partial HIPAA waiver. You would get a partial HIPAA waiver if you are doing a record review, but then you wanted to contact certain individuals later on and you obtain a full authorization. So that may be a full or a partial HIPAA waiver. And information is already collected, so it's on the shelf prior to study submission. So if you wanted to do a retrospective chart review starting today, all that information had to exist yesterday. So you submitted your IRB paperwork to us now, everything had to exist yesterday. Okay, so going backwards. Prospective may be reviewed as only expedited. There is no such thing as a prospective chart review under exempt status. You may request a consent or a waiver of consent. You can get a full HIPAA authorization or a waiver of HIPAA, so a full or a partial waiver, either one. And information has not yet been documented or collected at time of study submission. So these two aren't mutually exclusive. There's a lot of times that you want to do a retrospective and prospective, and that's okay. It would just be viewed under expedited review and not exempt review. So when can a retrospective study be exempt? So in order for a retrospective study to be considered exempt and fall into that special little category, certain things must occur. So information is recorded by the researcher that you cannot identify the subject. So individually identifiable data elements can't be recorded. Generally speaking, these are those 18 HIPAA identifiers, so name, date of birth, medical record number, any sort of insurance number. So if you want to just say subject, this is when you do and don't need to submit a modification to our office. So if you are adding text or images or anything like that to study documents, yes, you should submit. If you're changing a study's population, recruitment methods, adding visits or instruments, or anything else that can alter the risk, yes, you should submit to us. basically anything not mentioned in the no category. But the no category is really cool because if you are updating documents to correct typos or maybe small little grammatical things that's not going to impact the risk to the subject, that's fine, go ahead. Doesn't matter to us. You know, we like that. You know, we like things looking a little bit better. It's not something that we're going to ding you on during the review process, or at least we shouldn't be dinging you on during the review process. And so if you need to correct, you know, the instead of TEH, go for it. Changing font, color, or text size in any materials, that does not alter the risk to the subjects. Feel free to go ahead and do that if you'd like. Or moving 2 IRB approved forms into one, or, you know, splitting one into 2. I actually had somebody email me and ask me about that, and I said, it doesn't matter to me if you're asking them in 1 form or 2 forms, so long as the text is the same, so long as you're not changing anything else. And also, if you're uncertain, feel free to contact us. You know, you can just call us up and say, does this need a modification? Do I need to submit for this? And, you know, we may say, no, you're good, go ahead. Or we may say, yes, just go ahead and send it in. Okay. So any questions about modifications and what needs to come to us? So again, we're trying to make it a little bit easier. We're working on it.
This might put you on the spot a little bit because I actually don't know the answer myself. What if you're trying to decide between submitting a modification for a current study and submitting a whole new study? You know, are you just changing your research question? Are you just changing one of your populations? I feel like it's not totally clear.
So really, if you're not sure if you should submit a modification or a new study, again, a lot of it does depend on your research question. You know, maybe you get into a study and you start looking at the data that you've collected thus far, and you're doing an interim analysis, and you think, wow, it would be really interesting to analyze data for this. So long as it's not going to impact the population and it doesn't really go outside of what you've already consented subjects for, I don't see that that would be a cause for a new study. I think that you could certainly submit a modification for that. But if it goes beyond what you have presented to your subjects, what they consented for, what they, you know, indicated that they wanted to participate in, then I think that that's something that you might want to consider a new study. Yeah. Does that answer your question?
Or it drastically changes the research question.
Right. Drastically changes the research question, drastically alters risk, things like that. Okay. All right. So we also get this question quite often, especially from students. This seems to be a really big student question. They want to know, can they come in? Can we go over their forms with them? Can we tell them what we're looking for? So while we do welcome your questions, we want you to ask us questions, and we are available to help you identify the categories of review and let you know when you need to submit documents. We can certainly help guide you through the forms by clarifying what certain sections mean or what's required for review. Our criteria for approval comes directly from the federal regulations. So that's something that is universal and not just a GW criteria for approval. So that's something that we can kind of help guide you towards. And we can also meet with you to discuss your study and provide clarification or recommendations prior to submission. This is especially important if you're conducting multi-site study, or if you're collaborating with other institutions, or maybe you are working with a very vulnerable population, like you know, you're working with pregnant teenagers. That's 2 out of 3 of our vulnerable populations, and if they're in prison, there you go, that's 3 of them. So you know, these are the sorts of things that we're happy to sort of help you navigate and work with you on. And again, we don't want to hinder your research, and we don't want to seem adversarial. We, you know, can certainly help you with anything you have as far as this goes. So for a review process, we get this a lot. People want to come into our office and meet with us to talk about the review process. So this is it. This is how it goes. And for those of you that have submitted, you know how it goes. You submit everything, goes to an analyst, they email you, you know, you get questions back, you kind of do this back and forth a little bit, and then it goes for formal review, either by an exempt designee, which is everyone in the office. We can sign off on those, or it goes to a member of the IRB for expedited review or full committee review. So this is how it goes, okay? So if you have students, some of you may have students that want to know about the IRB review process, or that want to say that they want to go and meet with members of the IRB to know what they need to do and how they need to submit. This is how you need to submit. This is it. It's pretty straightforward. All right, so principal investigators, this is also something that's been coming up a lot lately about principal investigators and PI exceptions. And we have a lot of PIs that like to travel. We have a very global research community here. So, as you know, the principal investigator is the individual who assumes full responsibility for the project. So whether it is an MFA employee, School of Medicine, if you are a GSHED PI, whatever it is, you are in charge of this study. At GW, you must be a full-time faculty member, and there are limited exceptions for this. Like I said, we do have some PI exceptions. And then one research team member should be designated as the principal contact. I know that, Sean is a principal contact for a lot of studies, Valley's principal contact. So that would be sort of you're coordinating it for the PI, but the PI still assumes full responsibility, okay? So securing IRB review and approval for research, including any modifications to approved research. Following institutional policies and procedures, we have started posting all of our revised approved policies on our website. It's under guidance and trainings. Feel free to click on that tab and look at our policies. They're there for you to look at and to read and to know. Ensuring informed consent is properly obtained and documented, or you have a waiver of consent. Ensuring that continuing reviews are submitted at least 30 days in advance of study expiration. Submitting modifications and obtaining receipt of approval before changes to research are carried out. And ensuring prompt reporting of any unanticipated problems involving risk to subjects or others in any serious or continuing non-compliance, and research record keeping. So if you are the principal investigator, this is what you have to do. Okay, you are responsible for all these things. You may have a coordinator that does a lot of this for you, and that's fine. We understand how it works, but just know that this is what is expected of you from the IRB. So who can be a PI? Any of these 5 individuals here, a full professor, associate or assistant professor, a research professor, or a research scientist. So if you want somebody at the helm of your research study and they do not fall into one of these appointments, you must obtain a PI exception form. That PI exception form should be submitted to our office directly for unfunded research. If you are conducting research that does have funding, then it should be submitted to the Office of Sponsored Projects, okay? If you have questions about that, we can kind of help you route it, but just know if it's not funded, it should come to us.
If your project is funded and you've submitted it to OVPR, attach that with your submission to us, because OVPR will not forward it to us. So if you're going to be going to sponsored projects and through the IRB, you need to make sure it comes to both places, because we won't know that you got approval.
If you are an adjunct professor or you're a visiting professor, or you don't have one of these appointments and you're going to be overseeing maybe a lot of culminating experience projects or capstone projects for graduate students, we can certainly investigate the use of what we call an umbrella exception, which means that you wouldn't have to submit this form for, or you wouldn't have to get a new form signed for every single study. And we could certainly look into that. You would still need to submit that form for every submission, but you wouldn't have to get it re-signed every time. Okay. So if you are a PI, or if you are a coordinator, or if you are a student and your PI is gone, what should you do? What actions do you need to take? So if your PI is just gone for a week or two, maybe they're on vacation, they went to Disneyland, you know, they're having a good time without you, you don't really need to do anything. If something happens while your PI is away, such as an unanticipated event, that's going to cause harm to subjects, or maybe there was a death that was study related. Contact the IRB as soon. For some reason, spell check was not my friend that day. As soon as possible to report the issue. We can edit this out of the slides that we post online. Then please let us know that your PI is gone, but that you wanted to submit this to let us know what was happening, and that they will sign the document as soon as they return. It's more important to alert the IRB to a serious adverse event or an unanticipated problem than it is to sit around and wait for the PI to sign it, okay? Really just let us know right away. Is your PI out of the country for an extended period of time, longer than a month? Maybe they are working on a project outside of the country and they don't have access to internet or a scanner or anything like that, and they can't get a document signed. It's recommended to have another faculty member serve as PI in their absence. This is a very easy modification to do. We can do it in the office for either less than minimal risk or minimal risk studies. If it's a full board study, it does have to go to the board, but the board meets twice a month. And oftentimes these types of study, or this type of situation, the PI knows that they're going to be leaving. It's not a sudden thing. So this is something that you should be able to get in with ample time to cover this sort of a situation. Something that we've been seeing a lot lately is a PI on sabbatical. We've seen this quite often with a lot of our graduate students. They say, but my PI is on sabbatical. Well, if your PI is on sabbatical, then they really can't meet all their responsibilities as a principal investigator, and you should choose a different PI, okay? So if you have students that come to you and they say, but, this is my advisor, but they're on sabbatical, just choose somebody else, okay? Because they really cannot oversee the project as required by us.
A note about changing your PI. In addition to the modification form, you will need to have the new PI sign the, whether it's the synopsis expedited form or the exempt registration form. The new PI needs to sign that, as well as the department chair.
Yeah. Because
it's obviously you're not starting over, but it's making sure that person is fine as well.
Yeah, thank you. Good point. So again, if you are a PI or if you oversee students, just really keep this in mind. Try to keep us aware of all these little situations that may occur. And I've had this question a lot: who can sign a form? A PI signature, so a principal investigator signature, is required on the following forms: synopsis or exempt application, modification, renewal, problem report, or closure. So this must be the PI to sign off on this. A coordinator cannot sign. Research assistant cannot sign. Okay? Again, like I said, if your PI is out, of the country, or they're away and maybe they're at a conference and a problem report happens, we get that. We know there are certain situations. Okay? But for the most part, your PI needs to sign these documents.
There's also been some confusion as to saying I'm the co-PI or I'm the co-investigator. GW recognizes one PI. So again, if it's going to be the situation where the main person is going to be gone for a while, you might need to switch it, or just make sure that they're able to sign any documents that you need them to sign while they're away or before they leave. Having that co-investigator sign, they're not the PI in the eyes of GW.
And if they can't physically sign the document for some reason, they don't have, access to a way to sign it and scan it, they can forward the document on from their email and state in the email that they're signing off on this. but they do need the attachment. So if it's, if they're changing the PI, they would need the document that lists them as the PI, basically, so we know that they've read that document and they're agreeing to that.
What Glenn was saying is have them sign everything before they leave is especially important with renewals. We have had a lot of instances where PIs are gone and they say, well, I couldn't submit this because I was gone and I couldn't sign off on the renewal. If you know you're going to be away, now I get it, there are situations, family emergencies, things that happen that you do have to be gone, and this is not an ideal situation. But we will accept your renewal form 60 days in advance. So once we send out that 60-day notification, we will accept your renewal form. That's not a problem. I've had people submit renewal forms to me 4 months in advance. That's totally fine, so long as it's signed. Just don't wait until the last minute and you get your expiration notice and say, well, I couldn't sign for it because I was out of the country, or I was gone on leave, or I've just been really busy. Because once you get that expiration notice, your study is expired. Okay, that's it. You're done. Study's expired. So just be really aware of your renewal times. If you are a PI and you know you're going to be gone, or if you're a coordinator and you know your PI is going to be gone. Okay? However, if there is a consent document or other sort of document, I had somebody say that they had a withdrawal form for their subjects. A designated research team member can sign those documents on behalf of the principal investigator, provided that that team member has been appropriately trained in the consent form and in the study and in human subjects research protections, and they can address all questions and concerns about that study. Additionally, that designation must be made in advance and on a document that's easily retrievable or provided to the IRB, such as a delegation of authority log. Okay? Does everybody know what a delegation of authority log is? Okay. I see some of the clinical people going yes. I see some of the S&B people going no. It's basically a document that lists all the research team members and what their roles are and what they can and cannot do over the course of that study. Okay? So it's fine for them to sign as a research team member on the consent document, in place of the investigator. So grants and other funding sources, this again is a continuing issue as different funding sources have different requirements for submission, for when you have to get an approval, things of that nature. And again, I know this is very small print and very difficult to see. However, the NIH and NSF, so I'm just going to kind of do a little brief analysis here. They both tell you that you can submit at any time. And they both encourage you to submit to the IRB at any time. So what we strongly recommend is that after you submit your grant application, if you know you're going to be conducting human subjects research, we really encourage you to submit to the IRB. And the reason for this is a lot of times, just in time, you get 2 weeks or less to turn that around. And if you have a very complex study, or you have a study that has a lot of different phases or moving parts, or maybe you're going to contract some of it out, that can be a real tricky review, especially around maybe holiday time or vacation time. So these are the sorts of things that we would really like for you to do, is to submit to us when you submit your grant. Make sure that everybody has their city training up to date. Make sure that everybody is, right in line. And the NSF and NIH both encourage that. In fact, per the NSF Office of Budget, Finance, and Award Management, researchers should file their proposal with their local IRB at the same time they submit to the NSF, so that the approval procedure will not delay the award processing. So they really encourage you to do that. We encourage you to do that. And I know that people say, but what if I don't get funded? Or what if I need it tomorrow? What we really want to see is, do you need IRB approval, or do you need an IRB number? Because there's a lot of different funding sources that have different requirements. And a lot of it also depends on not just your funding source. Maybe you're going to the NIH, but they have different departments or they have different grants, and some of them only need an IRB number and then others need a full IRB approval. So if you need an IRB approval, they may ask for it after submission of the grant application. If you need approval prior to submission, which has happened, we've seen that they want to have your IRB approval with your grant submission, let us know and give us the document that states that. That way we can kind of look at it, because they speak regulatory and we speak regulatory, so we can kind of decipher what it is that they're asking, okay? Or do you simply need an IRB number? If you need an IRB number, submit your study in its entirety and request that your number be provided to you when we send you that little email of your submission's been received. Maybe when you submit it, just say, hey, you know, I really need this IRB number for my grant application, or I need an IRB number to prove that I'm under the review prior to receiving my award. That's totally fine. We're more than happy to do that for you. But we cannot provide you with an IRB number without a submission, okay? A lot of times we will receive submissions for studies that maybe need an IRB number or need an IRB approval, but all the instruments haven't been developed yet. So you're kind of in a catch-22. You don't want to develop the instruments and everything until you get funding, but you need to have the instruments in order to receive IRB approval. We get that. We understand that. A lot of times what we'll just want to see is your application, your grant that you submitted, and kind of have an idea of what it is you're going to do. So maybe you submit a draft or just a sample of instruments that you're going to be presenting to your subjects, and later on you do a modification to get those solidified, okay, and you get the final versions approved. That's totally fine. We're okay with that. We'll work with you to get that through. How long does it take? An exempt study can take up to 2 weeks to review, which is the exact same time that you have for a JET, mostly. And an expedited study may take 4 weeks to review. So when you get an impact score, maybe you get, you know, a really great impact score of below 40 and you think that you might get an award, I would recommend go ahead and submitting that as soon as you get your impact letter. Submit to us, because you know how long it's going to take to review these. Your submission will not be accepted if any research team members have not completed Human Subjects Protections training or CITI within the previous 2 years. So make sure that everyone on your team has their CITI done. Verify that they're up to date before you submit to the IRB, because we will return it to you, and that's really going to impact your review time. Okay? So it may be that initially all you do is submit the PI and the coordinator or the primary contact. Maybe you know that your city's good and you submit with those 2 people, and as you go along and you get your award, then you can submit the rest of the research team. Just whatever is going to work best for you and for us. Okay, it's a very symbiotic relationship here. So what if you don't get a notice of grant approval? So you don't get a NOGA letter. It happens. You know, it happens. You can either close your study if it's a full committee study, or if it's an expedited study, or you can keep it open to pursue other funding sources. I always kind of say, you know, did you marry the first person that said yes to you for a date? You know, like maybe you did, I don't know. But, you know, for the most part, you're gonna ask a few people out on a date before you decide, yes, this is the one. So it's kind of the same thing. Maybe you can go to other funding sources. And the great thing about that is that you already have your IRB approval. So you're ahead of everyone else. You're like, haha, I've got my IRB approval. I don't need to wait. And funding is not a requirement to conduct a study. We don't require you to have money to do your study. So maybe it's a really great study and you want to continue with it without funding. That's fine by us. We encourage that. Okay. So that's just sort of our grant culture in the office at a glance. If anybody has any questions about when to submit, when you want to submit, you know, what sort of documents we need, we're happy to address those. So be advised that sponsors are getting increasingly aggressive with timelines. I have actually seen a 24-hour turnaround. The that was the worst. The 24-hour turnaround was the worst time that we had to get something reviewed and approved. And that was actually over Thanksgiving holiday. Yeah, so I think that they got the 24-hour, when was it? They got it on like a Tuesday?
Mm-hmm.
Yeah, they got it on Tuesday before Thanksgiving. So this is why we really encourage you to get stuff in as soon as possible. Because what had happened if everyone in our office was gone? You know, and maybe, you know, Glenn was the only person there to, you know, log things in, but he doesn't review
You're not
studies.
going to get an approval.
Yeah. Glenn does not review studies, or, you know, or maybe there were no designees because they'd all gone on holiday. So it does happen. Again, we talk about your project may have phases, some of them that aren't human subjects research and some of them that are. We'll work with you on that. So your sponsor may still require that you obtain approval regardless on when you intend of initiating maybe a human subjects research phase. They may want to have that right up front. Let us know. We're happy to work with you. If we say that something is not human subjects research, or maybe it's exempt, the funding source may disagree with our determination. I've seen it happen on several occasions. I see Sean smiling and nodding his head. Yes, I know it's happened to you. It's also happened the other way, right? So, you know, this happens, and it just means you have to come back to us. We really encourage you to maybe have those documents at the ready and ready to go at any point in time. Feel free to copy and paste from your grant. We don't have a problem with that. The funding source can request a study undergo IRB review, even if we determine it's not human subjects research. A lot of it depends on how you write your grant. And it's important to be prepared for all these situations because you never know what's going to happen. Always have your human subjects protections training up to date. Make sure you have any research team members you want to add on there. They're ready to go. Be prepared to submit all the documents that we need. And identify how collaborators will be involved. And have a plan for their IRB review. Are you going to be the prime awardee and you're going to request an IRB of record? Or are you having your collaborators undergo their own IRB review? So these are questions that we're going to ask you during our review process, because we want to make sure that everything goes smoothly for everyone. Okay. All right, so we're coming into the home stretch. So these are just frequent questions and concerns that come into the Office of Human Research. These were compiled by our star reviewers, Brittany and Lizzie. So we're going to go through a few of these. If you have a large subject pool and you're concerned that you won't be able to recruit enough people if you can't get consent from them, can you get a waiver of consent because it's going to be easier? No. No. Your study must meet specific criteria to be granted a waiver of consent. So we do receive this question actually more often than you would think. Is anonymous data the same thing as de-identified data? No. De-identified data is collected as identifiable and then scrubbed of all information that may potentially identify a subject. So this is both direct and indirect identifiers. Anonymous data never collects any identifiers at all whatsoever. Okay? And if you have an IRB application form saved on your computer or linked to your Google Drive, can you use those when submitting an application? No. We are currently revising our forms and continually revising our forms, so it's always a good idea to pull directly from our website because that is where the most up-to-date forms are. Especially if you have a legacy study that's been going on since 2008 and you've been submitting the same synopsis every year, we're going to ask you to update that because that document has changed a lot over those years, over those 7 years. And we want to make sure that we have the most up-to-date and accurate information, not just for our purposes, but for your purposes. What if you get audited? You know, these are the sorts of things that we need to make sure that we're all working together on. Okay? And finally, a question about problem reporting. Let's say one of your subjects got into a car accident after leaving a study visit. What do? Well, if related to study procedures, report it to the IRB within 5 days. In this case, you should talk to the subject, to determine if the car accident is related to the research. So did you give them a study drug that maybe made them a little woozy, or maybe they kind of nodded off a little bit at the steering wheel? Or was it a very easy research visit where they came in and answered a few follow-up questions and then went on their way? Okay, so you kind of have to assess what was the research activity that took place prior to this incident. If the subject's, again, in an observational study, you really wouldn't need to report something like that, but if you feel that it's directly related or possibly related, those are the sorts of things that we want you to report to our office. If study documents are lost, that's considered a breach of confidentiality. If a subject faints during a research blood draw, that should be reported to the IRB. I've actually had both of those things happen to me personally. The first one, so I thought I lost study documents. I reported it to the IRB immediately, then found the study documents after I reported it to the IRB, so everything was good. And I actually fainted during a research blood draw when I was a research subject. So both of these things have happened. Both were reported to the IRB. So the reason we're putting this up here is not just because we want you to be aware about problem reports, but we have actually revised our problem report policy and our problem report form. So if you come back to the April IRB forum, we have a little plug here, it is actually going to be all about problem reporting, what you need to report, when, to whom, and what you need to submit to our office. So we're going to talk about the new problem report form, the new policy, and give you an opportunity to ask questions about problem reporting at that time. So that concludes our presentation for today. Does anybody have any questions for the IRB staff or us or anyone else in the audience? No? If not, I thank you all for coming. Have a wonderful day. Don't get blown away in the wind out there. And we will see you next month. Be on the lookout for our ad. Also, there is a responsible conduct of research presentation this afternoon in Ross Hall. It is going to cover data acquisition and management. You are all welcome to attend. I want to say it is Ross Hall room 212. Okay? Thank you.